I want you to picture a scenario. I'm almost positive everyone listening has been here. It's 5:01 p.m.
No.
Exactly 1 minute past closing time. You've been running around all day, stuck in meetings, wrangling kids, whatever, and it hits you like a ton of bricks. You forgot to call the doctor.
I know that feeling so well. It's that little pit in your stomach.
Right. And it's always for something urgent, a prescription refill you need for tomorrow, or some weird symptom that's been nagging you, or you just need to reschedule an appointment you absolutely can't make.
So you dial the number, just hoping.
Hoping someone is still there finishing up paperwork. But what do you hear?
I can hear it in my head right now, the click, and then the robot voice. Our office is currently closed. Or, even worse, the endless menu. Press 1 for appointments, press 2 for billing.
And somehow none of the 9 options are what you actually need?
Never.
Exactly. It's classic voicemail limbo. You're trapped. And now you have to wait until tomorrow to start the game of phone tag all over again. It is so inefficient, and honestly, it just feels broken.
It feels archaic. And that frustration, that is exactly what we're digging into today. Because the healthcare industry, they know this is broken. They get that illness doesn't stick to a 9-to-5 schedule.
So what's the solution?
Well, it isn't hiring an army of receptionists to work the night shift.
Right. So today we are doing a deep dive into voice AI in healthcare. And before you roll your eyes and think, great, more robots, we're not talking about those old phone trees where you have to scream representative 10 times.
No, absolutely not. This is a completely different beast. We're looking at a big report called How Voice AI Improves Patient Engagement Across the Care Journey. And the key here is conversational AI.
Okay, so the mission for this deep dive is to see how this tech is fixing those broken parts, from scheduling to recovery. We're exploring how we move from episodic care, seeing a doctor once a year, to something more continuous.
A huge shift. And it really starts with defining what voice AI even is in this context. Because like you said, people hear voice automation and they immediately think of those old IVR systems, the press 1 for English stuff.
Yeah.
This source makes it very clear. This is about natural speech.
Okay, so walk me through the technical difference. If I call a modern voice AI system versus an old one, what changes for me?
The main difference is something called intent recognition. An old system is just listening for a specific word, billing, or a keypad tone. It's rigid.
So if I say something slightly different, it gets confused.
It completely fails. If you say, why is my bill so high this month? No, an old system just hears noise.
And it says, I didn't catch that, and you want to throw your phone.
Exactly. Modern voice AI uses what's called natural language understanding, NLU.
Yeah.
It deconstructs your whole sentence to figure out what you want, the intent behind the words.
So it understands me when I talk like a normal human being. I don't have to use keyword speak.
Precisely. It engages in a human-like dialogue. And, more importantly, as the report emphasizes, it performs meaningful actions. It's not just a gatekeeper, it's a doer. It can actually go into the system and change things.
Okay, let's unpack meaningful actions. The report talks about meeting patients where they are. To me, that sounds a bit like marketing speak.
It does, but in practice, it really solves that 5:01 p.m. problem we started with.
How so?
Think about accessibility. A huge barrier to care is just human availability. Clinics close, humans sleep. But if you wake up at 2 a.m. with a post-surgery question, a human isn't there. Voice AI is.
And it's not just leaving a message. You can actually say, reschedule my follow-up, or what are my next steps after surgery? And it gives you an answer immediately.
Right. And think about the psychology of that. If you have to wait 24 hours to ask a question, you might forget, or you might just spiral into anxiety all night. This reduces that friction. It stops that feeling of being alone.
It's interesting. We usually think of technology as creating distance, but here it's almost filling a void.
That's a perfect way to put it. Yeah. It's presence where there used to be absence.
Okay, so there's the convenience factor. I get it. But let's talk about the administrative side. I mean, I hate making the call, but I'm sure the doctor's office hates the chaos of scheduling just as much.
Oh, absolutely. The data is staggering. The report mentions that missed appointments, no-shows, cost healthcare organizations billions of dollars a year.
Billions? Really? How does it add up to that much?
Well, it's a cascade effect. It's not just the lost copay. It's the staff sitting there, the building overhead. But more importantly, it interrupts care. You miss your checkup, your condition might get worse, and that leads to an emergency room visit 3 months later, which is way more expensive for everyone.
Right. A missed checkup today is a hospitalization tomorrow.
Exactly.
So How does a robot voice fix that? I mean, I get texts now reminding me of appointments, and I still forget or ignore them.
Well, see, that's the difference between a notification and an interaction. The source calls this an intelligent appointment reminder. Voice AI doesn't just blast a message at you, it calls you. And if you say, actually, I can't make it, it doesn't just hang up.
It rebooks you right there.
Exactly. It offers alternative times instantly. It syncs directly with the provider's calendar and the electronic health record, the EHR. So it's handling the logistics in real time. Okay, Tuesday's out. How about Wednesday at 10 a.m.?
That's a huge upgrade because usually if I can't make it, I have to call the office, wait on hold. It's a whole process. So I just procrastinate and then I become a no-show.
Precisely. It removes the friction. And from a planning perspective, this allows clinics to keep their schedules full. If you cancel, that slot can instantly be offered to someone on a wait list. It stops the gaps before they happen.
So it's good for me and it's good for the business side. But let's pivot. Can a voice bot actually help me get better? I mean, that's the real question, isn't it?
That is the critical question. Can it improve health outcomes?
The source talks about medication adherence, and I am so guilty of this. I forget to take vitamins, let alone prescriptions.
You are not alone. It's a massive issue. People forget or they misunderstand the instructions with food without food, or they just don't refill the script. The report describes the AI approach here as empathetic.
Empathetic. That's a strong word for software. How can code be empathetic?
It's a simulation of empathy, but it functions effectively. So it doesn't just send a buzz to your phone. It can make an interactive call. And if you say you missed a dose, the AI asks why.
Wait, it asks why, like a person.
In a way, yes. It engages you. If you say, I didn't take it because it makes me nauseous, the AI recognizes that as a side effect. It doesn't just log patient noncompliant. It logs patient experiencing side effects.
That is a huge distinction. Usually the doctor just assumes you're being lazy.
Exactly. And based on that, it can offer options. Try taking it with a meal. Or critically, it can escalate that specific issue to a human clinician. It acts as a triage system. It filters out the noise so the human can focus on the signal.
That's fascinating, because if I just ignore a reminder, nobody knows why. But if I tell the bot, this hurts my stomach, that's a crucial piece of data the doctor needs.
Exactly. It moves from a passive alert to a meaningful dialogue. It captures the reason for the behavior.
That leads right into the next area the report covers, post-discharge support. This is that vulnerable period, right? When you leave the hospital and you're suddenly on your own.
Yes, that transition from hospital to home is one of the weakest links in healthcare. Readmission rates are often high, and it's usually because of poor communication. You get home, you're tired, you have a stack of papers you didn't read.
And you don't know if that pain is normal healing or something serious. It's scary.
It is. So the AI steps in to do what's called PRO, collection patient-reported outcomes. It does scheduled check-ins. It asks structured questions. Is your incision red? Do you have a fever? On a scale of 1 to 10, how is your pain?
So it's screening for symptoms.
Correct. And if you report something concerning, say, a fever of 102, the system immediately flags it for human intervention. A nurse gets an alert right then. You aren't just suffering in silence at home.
That sounds incredibly reassuring. It's like having a nurse check in every day without the cost of actually sending a nurse to your house.
And that consistency is key for chronic care management, too. Things like diabetes, hypertension. Traditional care for these is episodic. You see your doctor, what, once a quarter?
Yeah, if you're lucky. And in between, you're on your own.
Right. And so much can happen in 3 months. Voice AI fills that gap. Daily or weekly check-ins about vitals, diet, lifestyle. It turns healthcare into a continuous process.
And I noticed the report mentioned tailored education. It's not just asking for numbers.
No, context is everything. Instead of a generic brochure, the AI can answer your specific questions. What time should I stop eating before my procedure? Things that are relevant to you.
There was one detail in this section that really stood out to me about inclusivity. The source mentioned Cabot's voice AI solutions.
Yes, this is a critical point. Not everyone speaks English as a first language. And medical terminology is hard even if you do. These systems can support multiple languages and dialects.
Which is huge. I've seen friends try to navigate the system for their parents who don't speak English well, and it's a nightmare. If you can't understand the care plan, you can't follow it.
And that leads to bad outcomes. So by offering support in a patient's preferred language, you're not just being nice, you're building trust, you're ensuring safety. It's really about equity and access.
I love that. But I want to zoom out to the system view. This all sounds great for me as the patient, but How does it work on the back end? You mentioned it syncs with the calendar. Is this
Yeah.
just another piece of software that doctors have to learn to hate?
That is the million-dollar question. And the source is clear. Integration is key. It has to be a seamless integration with the electronic health record. It's a bidirectional flow.
Bidirectional, so data goes both ways.
Right. The AI pulls information from the record so it knows who you are, but it also pushes data back into the record. So when you tell the AI you're having side effects, that conversation log goes right into your medical file for the doctor to see.
That saves so much time. No more repeating myself 5 times to 5 different people.
Exactly. And then speaking of the staff, let's talk about burnout. We know healthcare workers are exhausted. The source drops a massive statistic here. Voice AI can automate 60 to 70% of routine patient interactions.
Whoa, 60 to 70%. That's most of the day. Is that realistic?
It is when you think about what those interactions are. What time is my appointment? Where do I park? Can I verify my insurance? It's repetitive, low-level stuff.
So the robot takes the grunt work.
It takes the busy work. And if you take 70% of that off their plate, suddenly they have time to actually sit with the patient who has a complex diagnosis. They have time to be empathetic humans.
So it's not replacing humans, it's letting the humans be more human.
Precisely. It lets them operate at the top of their license, doing the complex thinking a robot can't do.
And I imagine the suits, the administrators, love the bottom line on this. The report had some ROI numbers, right?
It did, and they're compelling. Operational costs reduced by up to 50%?
Half. That is significant.
It is. Call handling time lowered by 25 to 40%. But here's the stat I think is most important. Patient satisfaction scores went up by 15 to 18%.
That's surprising. You'd think people would hate talking to machines.
You would think so, but remember the 5.01 p.m. problem. People value speed and getting an answer over almost anything else. They're happier getting an instant answer from a robot than waiting on hold for 20 minutes to talk to a stressed-out human.
That makes total sense.
Look at
It's
this.
not that we prefer robots, it's that we hate waiting.
Exactly. The source really emphasizes that engagement leads to outcomes. If you remove the barriers, the wait times, the language issues, people engage more. And when they engage more, they get healthier.
So, to sum this up, we're looking at tech that takes us from these fragmented, sporadic touchpoints, phone tag, lost voicemails, and turns healthcare into a continuous conversation. It lowers costs, reduces staff burnout, and for me, the patient, it means I can get answers at 2 in the morning.
That's the core of it. It's shifting
Well-
healthcare from being reactive to being proactive and always on.
It really does sound like the end of hold music, which I think we can all celebrate. But before we wrap, I want to throw one last thing out there. The source made this point that engagement is not just about communication, it's about outcomes. And we talked about the AI being empathetic.
Right.
So here's my question. We know it's simulated empathy, but if the AI is programmed to ask why and to sound concerned, and that actually helps you take your medicine, does it matter that it's fake?
That is a profound question.
I mean, think about it. As these systems get better and the voices get more human, will we eventually reach a point where we actually prefer the robot doctor? It never gets tired, it never has a bad day, it never judges you, it just helps.
The always available, benevolent presence.
It raises a fascinating philosophical question. Is care about the human connection? Or is care about the effective delivery of health? If the machine delivers better health outcomes because we're less afraid to be honest with it, maybe we stop caring about the soul behind the voice.
It's a strange future to imagine, but based on this report, it might be closer than we think. Something to mull over the next time you're debating making that doctor's call.
Indeed.
That's it for today's deep dive. To our listener, the learner, thanks for tuning in and letting us be a part of your day.
Stay curious and stay healthy.
See you next time.